Why have I quit my job? Why have I, bought a van? And why am I going to drive around the country? Well, I'm passionate about the idea that you need to be heard. And I want to stitch these stories together across the states. We're going to find the commonalities. And it's going to be really an amazing experience. And I look forward to you joining me on the jar. Good morning, good afternoon, good evening, depending upon where you're at in the world. My name is Ken Stearns. I'm the host of Mental Health Today. Thanks so much for tuning in, spending some time with us. Great show that we've been running for about a year and a half, 150 plus people telling their story, their mental health journey, either from kind of a provider side, trying to stop the crisis that we've got, or people in the services side, or people just sharing their own personal story. And then kind of my favorite, where two of those meet, and it's somebody who's had a real mental health story, their own journey, and then jumped full, both feet head first, maybe sometimes both feet first, but it seems to be quite often head first into the mental health space. A little bit like me starting this podcast. So Clive Stevenson and I have been talking offline. Clive's our next guest, and I really appreciated his note to me on the reservation and just sharing his own personal experience as a young man, having some real mental health challenges, thinking about taking his own life, and then seemingly Clive jumping both feet first into the pool. And here you are a couple of years later. Has it been what you thought it would be? Did the journey change? Did your purpose change over the last years?
Yeah, I guess it did a little bit, because initially when I was doing training, I've been involved in Mental Health First Aid England since 2007. Mental Health First Aid is international, 27 countries, originated in Australia, 2000, 2001, so 24 years of history. But I got involved in 2007 when I was working for the Department of Health, and I guess over the years it was very much swimming upstream, to use your analogy there, and I guess it's still swimming against the current a little bit, but the current's moving, it's changing. We're becoming more aware in terms of mental health, and we're becoming more able to express ourselves in relation to our own needs. And I think some of that might actually come from COVID, that it became normalized to say, look, I'm struggling. Normalized to reach in and say, look, how are you doing? So I think gradually it's changing, but it's like a ball rolling down a hill. It's got momentum, it's going in the right direction. It's got a
Yes.
long way
Yeah.
to go yet. Long way to go yet. Yeah.
Yeah.
So
It's got a lot of. I had never heard the COVID idea that the impact it's had negatively and then positively on mental health, right? And being able to talk about it and
yeah.
normalizing it. And heck, that was, one of the first conversations we had, with the staff and with the team during mental health. We get on Zoom calls and we would talk about family. How's it at your house? How are things? How are you doing? How are you coping? And we would spend, the first 5-7 minutes on calls just talking about the person. And that would have been the most awkward, silliest. I wouldn't give 2 cents before the COVID. I would have never thought to ask that question. I wouldn't want to know the answer before COVID.
Yeah. And we got permission through COVID, didn't we, to actually say, look, this is really difficult. And we got permission to say, look, how are you doing? So
Yeah, we had
I mean,
permission.
COVID was bad. It was, we lost people. It was a terrible time, but it something like that must give us something, Ken.
Yeah, and I think in the end, it's been a net positive. I think COVID's woken up a lot of people to for the mental health side. It's woken up a lot of people and made it, like you said, gave us permission to talk about it. I think I love that phrase.
Yeah.
Yeah, gave us
That's what we
permission
need.
to. Yeah. So what are you doing now? Tell us a little bit about your work and the suicide prevention and the education, the training.
I deliver 2 primary sets of courses. One is mental health first aid, which is very much like physical first aid. It's coming to someone's aid either before professional help's involved or instead of professional help, because the conversation with somebody may be enough to help them to move forward with whatever with
like
whatever
a peer,
difficulty, emotional
like a
difficulty they've
peer
got.
almost.
Yeah, I mean, we're trained. We go
Yeah,
through very rigorous training. To be a mental health first aid instructor, you don't need any professional training. I'm a mental health
right.
nurse by profession, way back. And I actually I I signed up to be a student nurse because I saw a national advert in the UK, and that national advertisement in a paper in the UK, and it said something like, "Come and make a difference, become a mental health nurse." I thought I can maybe do that. And so I really felt like I made a difference when I was a clinical nurse. As I got into management, I sort of lost that. I felt disconnected from making a purpose with people. And through starting to train with MHF England, and more lately through the National Centre for Suicide Prevention, Education and Training, must get a shorter title than that, but delivering suicide first aid courses, again, interactions with people that should prevent a
Mhm.
suicide interventions, if you like. Actually getting involved in training now, and I gave up all NHS work about 10 or 12 years ago. But now I feel I'm reconnected with that purpose. I'm making a difference because I make a difference through the people I train,
Yes.
because
Yeah.
they're more aware to support others, plus with them as well, because it's we have a focus on self-care. And to be honest, that's something we really do need to remember. Self-care is something that just drops off the agenda a lot of the time. So I'm making a difference by running the courses that enable people to intervene with others that are in difficulty emotionally. So it couldn't be a better place. It couldn't be a better place.
There is in the US, there's there's a giant, like I'm sure every country, there's a huge crisis, a shortage for
Yeah.
therapists. And
Yeah.
and to get in to see a therapist, and then there's different levels of frustration. One is just there's not enough. And then geographically, they're placed in very, city centric stuff. And you don't get people out in this on the more rural places, and
Yeah.
and then even where they are, they're overwhelmed and they've got billing problems. That just to get money back from the insurance companies. So one of the quick so there's no quick fix to this. And
No.
in my conversations with people, you look at the catch up timeline. It's 5 years, whatever
Mm.
the number is, right? It's at
Oh,
least
yeah.
5 years to get that pipeline moving into to service. Um,
Yeah.
so they have a peer program in the U.S. state by state, and if you have lived experience, you can also then apply and go through some training. You take some,
Yeah.
and a lot of it's quite lowbrow. It's not, some of it's state by state, so it's not nationalized. But there's definitely state training, and you take a little course, and you can become a peer, and then you can
Mm.
apply to do some mental health work, some social work.
Mm.
Typically, it's not going to be you're not going to be making any kind of money. You're not going to be living off this,
Mm. Mhm. Mhm.
but you can help and give back. And so I think it's an interesting it sounds like something almost close to the model you're working with.
Yeah, because what we're trying to do is enable a fair proportion of the country. I mean, our goal with Managed Mental Health First Aid England is to train 1 in 10 of the adult population in mental health
Okay.
skills, mental health intervention skills. We're currently at 1 in 40, which is really good. And when we get to a
It's pretty
tipping
good.
point, at some point, we will forever continue to have a shortfall of therapists, of clinicians,
Yes.
because funding doesn't exist to to employ millions more. But what we can do is enable the population to actually step into a
Mm.
space that where they can actually support someone else.
Yes.
You mentioned something interesting. It's people with lived experience. Who doesn't have lived experience, you know? We've all had our dark times, and it's
Yeah.
it's recognizing that, I guess, and using that to best effect, using that wisdom, using that
Yeah, it
self-awareness,
becomes
using the
wisdom, yeah.
resources we develop through that to actually support someone else.
Yeah, I stumbled across the program, and I ended up getting certified in Nevada, just to go
Mhm.
through the exercise. I didn't have any intention of doing any work. Yeah, I didn't
Right.
feel like I would ever be qualified for that to talk to somebody, and wasn't sure what that would look like. But I wanted to
Yeah.
go through the coursework to see what it was like to get certified.
Yeah.
And
Wow.
I did find it quite, it's not real rigorous, but rigorous
Yeah.
enough to,
Yeah.
and hey, it's, step by step. If you got somebody willing to go through the class, it's kind of enough of a bar for me to say that's a good enough person that's going to be willing to
Yeah.
listen and they're going to add
Yeah.
value. They're going to help out.
Yeah.
And later on, when we have too many people, we can raise the bar.
Yeah. Yeah.
You know,
Absolutely. And we run mental health first aid aware courses, a 4-hour courses for any of the population to take part of, and that's a very basic grounding in
yeah.
communication, in supporting, in trying to understand. Because let's face it, one of the major qualities we can have for someone else's benefit is the ability to seek to understand what they're experiencing, and it's all about that, isn't it? If I try to
Mm,
understand what you're going through and communicate that understanding back
yeah.
to you. Stephen R. Covey, Seven Habits of Highly Effective People, really world bestseller, said if we can do that and feed back to the person our understanding what it might mean to them now and in the future, it's like giving them emotional oxygen. I love that. Giving someone emotional oxygen.
Emotional oxygen. Oh, that
Yeah,
is
yeah.
pretty good.
It's
And so
fantastic. Isn't it?
that's
The ability to feel and
yeah.
be.
And I think that's a good point for listeners, right? Because that's a power. If you can do that, you could probably save a life.
Yeah, undoubtedly. Absolutely no doubt at all. Yeah.
I, this
Because
is,
I mean,
yeah.
we talked about suicide a little now, aren't we? Suicide exists when the capacity for dealing with emotional pain is exceeded by the pain itself, and people do not
Mm,
want to die. They want the pain to end.
they don't want to
So we
die.
can help someone, give them emotional oxygen to explore ways in which they might
Yeah.
resolve that emotional pain. Then suicide has got to be an avoidable death in very, very many cases.
It really is an avoidable death.
Yeah,
Um, yeah. Just talking to some of the clients, the interviews from the jar, which we showed the video of me, prepping the van. And they did, yeah, I shared with you the one gentleman, I just wanted the pain to end.
yeah,
And one woman describing it as, a terror she lived through minute by minute. Kill myself. Okay, give it one more minute. I'll kill myself in a minute. I'll give one
mm,
more minute. Okay, one more minute. And she was timing. She
wow,
had her timer, and she was timing it on
wow,
the iPhone, laying on her bathroom floor. And it would go off every minute, and she was just like, "Okay, one more minute. Okay, I got one more minute." And then the light would come, the sunshine would wake up, her kids would wake up, and then life took over, and she was out of that thought. She had no choice, back to life.
yeah,
So that oxygen, to me, the way you describe that, it's like it's a perfect description. It's just they're
mm,
suffocating.
yeah.
And
Yeah, and sometimes we
if
do live minute by minute, and if we can keep on doing that and pushing that minute and maybe extending that minute and maybe
yeah,
getting something to give us hope during those minutes, because it's about hope. Hope that things can change, hope that things might be different, and that's the big deal here, I think. The big thing we can
yeah. So
potentially
just
allow the person to
describe,
feel.
yeah, describe that oxygen thing, that idea again. It's how you can give people that you understand. You can reflect back that
Yeah.
you have an idea of what they're going through.
Yeah, and it's gotta be an idea, isn't it? We can't truly understand. In fact, one of the worst things we can say is, I know exactly what you're going through. I know exactly what," 'cause you
Yeah, that would
don't,
be the wrong. That would be the
Yeah,
wrong answer.
absolutely, absolutely. But we can try. I mean, we need to listen, and there's a reason why we've got 2 of these and 1 of
Yep.
this. Need to do a lot more of this. So it's really listening to try and understand, really truly trying to understand what's happening for the person. And if we can get to that state, and we can communicate back our idea of that understanding, what
Mm,
it might mean to them now and going forward, that is a connection. And connections are so powerful. If you feel connected, I mean, there's states, there's connectedness. There's when we miss people, we get lonely. So there's
ooh,
loneliness. There's also aloneness, and aloneness is loneliness is missing people. Aloneness is having no one.
is
And very often
feeling
when we're in
really
our
truly
darker
alone.
times,
Yeah.
yeah, in our darker times, we are alone, minute by minute, pushing the minute across. If we
Yeah.
can actually connect with somebody and understand that experience in some small way even, but communicate it back what that might mean,
Hmm.
and that, there are things in there that may not be as they perceive it. We press the pause button. We just put a halt on something for the time it takes to actually connect and explore other possibilities of ending that pain, and it's a great thing to do to someone, or for someone. It really is life saving if you can connect with somebody and give them some sort of sense that things might not be like that in the future. Even in a small
Mm,
way, a chink of light, a little small amount of hope is really
yeah.
powerful. Yeah,
toughest client you've had? I mean, did you back in the
Oh,
day you had clients. I mean, now you're teaching teachers.
yeah,
Um, but back in the day, there's got to be one still sticking with you.
yeah, yeah. It is. It's a lady who used to threaten to end her life on a repeated basis, and I just couldn't understand what I could do. It was really, I felt helpless. In supervision, I shared that helplessness. I did a risk assessment, which risk assessments are not entirely safe things to do, but the risk assessment indicate that she would survive, yeah, and go on living over a period of time when I wasn't there. I was a community nurse at the time, and she was a person in the community. But it's finding out what the person needs. For me, I've come to believe, and it's an absolute genuine fact. All behaviour is communication. All behaviour is communication, and all communication is an expression of need. Now, this particular person had a need, and it was really difficult for me to actually try and find that need because there was this threat of suicide there, and I couldn't get past it. I was risk assessing. I was up here. I was trying to fix the issue, I
Yeah.
guess, rather than really trying to understand. And it's back to that really. If you can understand what the need is based on all behaviour is communication, and there's a need in there somewhere that's driving that communication, then there's a chance that you can actually help that person to move forward.
Yes.
And once I did that, yes, it was potentially the most difficult situation because I felt helpless. I felt my professional
And you
knowledge
don't know
wasn't
when
enough.
she'll do her threat.
No, so it was, I didn't sleep
Yeah. I mean,
well.
you're terrified,
So
right? Yeah.
yeah, yeah. But when it and moving to the sort of more needs based, more sort of connection based, less professional control based, because many of the times we're trying to control behaviour as professionals, and we need to understand behaviour and relate to that, and understand it and help that person to gain whatever they actually need to gain from that behaviour. So yeah, it's like I say, that's probably, I don't think I've talked about that for a long time actually, but that's probably the most difficult thing. Realizing that my professional skills weren't enough. I need to actually have
Oh, that's
more human skills. Yeah.
also terrified. Like when you can't fix it. And
Yeah. Yeah.
knowing you, I think sometimes when we know we're struggling professionally, we think we're good, we've got a lot of training, a lot of experience, and you
Mm,
have this situation where you're not on top and you can't solve it.
yes. Yes. Yeah. And it does give you sleepless nights. And as I was talking about risk assessments are fundamentally flawed because we're all very different and we express our pain in different ways. It's very difficult to gauge that pain in numerical value or sort of any value at all. So it's around really that human connection, that human interaction, that human understanding that can help someone to actually move through whatever they're moving through or need to move through. And that was
Su-
sort of a learning exercise, believe it or not.
Yeah.
Yeah.
Suicide rates in England, what's the trend?
Upward. I
Really,
remember at the beginning
still?
that yeah, it's flattened out and reduced a little bit during the pandemic, but as fair bit of that was delays in registrations because we count suicides
Yeah,
based on
yeah.
the date they were registered.
Yeah, yeah.
So coroner's inquiries and things
Everybody
take a
died
while
of
to come
COVID
through
those 2
suicide.
years.
Yeah, so they
If
were
you
busy.
if you
Yeah.
died, you were a COVID death.
Yeah, but we didn't have the tsunami of suicides that was expected. We didn't have the massive rush of suicides. They flattened off a bit, but a lot of it was due to delays in registrations. However, it now the latest ones we've got in 2013. It's just over 6,000 people in England and Wales died by suicide or registered as died by suicide, which is the highest number since 1999. And with females, it's the highest number since 1994. So we're seeing a definite increase there. And the
Hmm.
reasons for that are various. I mean, suicide's a really complex thing. There's changes in behaviour based on what's happening. I'll give you what you're saying about therapists and the availability of therapists and
Yeah.
therapy and services. Our lowest suicide rate is in London, which is the most frantic, performance-driven, stress-inducing community we've got in the UK. Uh, our highest, that's a low suicide rate. Our highest suicide rate now is in the northwest of the country, which is beautiful.
Yeah.
It's got places like Manchester, thriving cities, but lots of open space. Second is the northeast. Last year, tops in terms of suicide rate was the northeast, where I'm from originally. I'm from the northeast of England. Another very lovely place, a very industrial, traditionally industrial area, just like the northwest. And of course, industries petered out, changes, the inability to get support very
Okay.
quickly because it's not around the corner as it is in London. So there are reasons why people do seek to take their own life based on economic difficulties, based on what's happening in their own worlds, their history. If you've been in the care of a local authority during your childhood, you're more statistically more likely to end up dying by suicide or at risk of suicide. So there's lots of combinations of factors at play.
Hmm.
Availability of the means to take your own life as well, which is one of the reasons why the US has a higher suicide rate than we do in the UK.
Interesting, right? It's
Yeah,
but you'd expect it to be in London where where it's chaotic and everybody's crammed in together, but you
yeah,
have connections there. Maybe
yeah,
it's,
yeah, yeah.
you
And
know,
you can get a therapist 300 yards away,
ah,
or a
I
service
mean,
300 yards away. Very often.
yeah, I mean, there's such a connection to that, right? Having a therapist around,
Mm, mm,
having access to a therapist can't
mm,
replace the value on that.
mm, mm. No, no, absolutely. I mean, we ultimately do need mental health professionals to actually support us when we're at our darkest times. We really do need, and part of our function as mental health first aiders, as suicide first aiders, is to connect people to that professional support, which is vital in terms of preserving life a lot of the time.
And even talk about the self-help stuff and, boy, it'd be amazing if we were taught how our brains function in high school, in college,
Yeah,
and we were taught about, your feelings and emotions and how
yeah,
to have self-talk and, how to listen
yeah,
to a simple motivational tape
yeah,
that can help, help you with a positive mental, at least you've got that reservoir,
yeah,
to get your bad thoughts have got to get through some filter to get to the really dark places.
yeah, yeah. I like the sense of that reservoir. We've got a reservoir of healthy stuff. We've also got a reservoir of pain as well, haven't we? We've got this stuff we
Yeah,
carry with us throughout our lives based on what we've been through throughout our lives. So I guess talking about therapists, that's where therapists can come in to help us to empty some of that pain reservoir out and
that's a
maybe think about filling it with other stuff.
I think that is a good point around the reservoir of pain that,
Mm,
is brought up again, right? Something happens and it triggers that emotion, that
mm.
memory, which then you feel physically in your body.
Yeah,
And, so it's interesting how it's just a thought. It's a memory. It's not here. It's not in the room. It's not a danger, but it can still that memory can make you feel like the lion is in the room, or your
yeah,
mother, or your father,
yeah.
or the teacher that, berated you, or the boss, and you
Oh,
can
yeah,
literally live the emotion like
yeah,
like it can get away from you, and you can let it if you let it get away from you, it can really run its own. It runs like a rock down the hill.
yeah. And those things stay with you. They are with you continuously, and something just triggers something like that, and you're back there again. And sometimes you don't realize why you're back there again. Sometimes you can't associate that particular instant, that memory, with the feelings you got now, and that can be really, really distressing. So it's
Hmm.
having an understanding of around where some of our stuff comes from, where some of our pain comes from, and seeking to
And
work
how to
through that. And
just
that's the
yeah.
realm of the therapist.
I was very lucky in as one of my first jobs, started in sales quite early, and we used to drive around. I used to drive around Los Angeles County in between appointments, going places or after lunch, and I had tapes. I had these motivational tapes that we had. I was in sales, and
Yeah,
we all had motivational tapes because it was such a having people slam doors in your face, tell you to get out. And it was an emotional trauma every day, right? And you had to
Yeah.
go, you
Yeah.
had to literally climb back up. If you wanted to eat, you had to go subject yourself to this abuse in the hopes that you would sell something. Somebody would
Mm,
treat you right, or you'd happen to, turn the right door handle.
mm,
And so, I spent loads of time with positive talk, uh, mental really, and I think it was mental health training in a way, being
mm.
having a reservoir. So whatever reservoir of pain I carried around and add to it, I always had this deep reservoir of positive thinking and experiences and stories that I could go back to and remember,
Yeah.
that things
I
do
I
get better and this too
I
shall pass. And
I guess you never, have that, or, what you're describing is not actually eating into the reservoir of pain. You're building capacity in the vessel that holds that pain.
yeah,
Yeah?
that's what it is.
Yeah.
That's a really, yeah, you're at the reservoir of pain and I'm building capacity to deal with it.
The top of it. Yeah.
Yeah, on
Yeah.
top of it, a little bit of a before you get to my really soft spot, you're gonna have to
Yeah.
get through I've got some really good analogies and I have stories that are gonna, defer your little games, and I will survive this. You won't get to my weak underbelly very
Yeah.
easily.
Yeah. That's it.
Well, it is a true thing, right? And I think
Mm.
today, even today, I practice those same kind of things. I carry around. These are cards.
Yeah.
I have note cards that are just positive affirmations that I carry around, and I like to think I would imagine, I would like to think that by now in life I'm bulletproof. But yeah, but
Well,
no, yeah.
it's a nice thing. It's a nice concept. Yeah.
I would like to think is what I think. I think I did stumble with my precursor there.
Yeah.
It's like I'd like to think,
Yeah.
or I should be, or I don't know what it is,
Yeah.
but I should be
It's
way
a
better than I
it's a bit of
am.
a vest, I guess. You're not bulletproof, but it's a bit of a vest you can wear. Yeah.
Yeah, I wish it was a lot thicker. It doesn't seem to perform
Yeah.
very well at times. There's certain times it feels like the bullets get through.
Yeah. Yeah.
It definitely feels like that. Um, what's next now? You're on the path. You're teaching professionals and trying to
Professionals
get that.
and, well, people actually. I don't.
I'm sorry,
I
you're teaching people
yeah.
some professional techniques to go out into the community.
Yeah. I mean, a lot of in fact, it's almost all within workplaces.
Okay,
Um,
in
I
workplaces.
Yeah. So I have my own clients, but I also do work on behalf of Mental Health First Aid England, who have their clients directly booked with them, and I go into workplaces and run courses and have conversations. I mean, the course
Okay,
itself is yes, 24 years of development, and the product is excellent. But the conversations we have in those workplaces, I was running a course for the last 2 days, face-to-face course because I do online as well, with an organisation that make medical devices. They're an industry
okay.
leader, and it was fascinating to hear some of the pressures that they're going through and think about what that means to them, but also their colleagues and how they can have helpful conversations within the workplace and
Hmm.
change some of the stigma it's around, because there's loads of stigma still around mental health issues, around suicide in particular. And stigma is a really powerful thing. It's a badge of disgrace. So we're trying to, or I'm trying to affect change primarily through people working in workplaces. So I'm commissioned to go in and
Okay,
run
okay,
courses for them.
okay.
But I have run, and I do run courses for professionals as well, for mental health trusts and NHS trusts. Yeah, that's incorporated in workplaces for me. So it's yeah, I run courses with people. Full stop.
How do people find you? So how do your clients find you? So you're doing corporate work. How do you
Through
find
through
clients, or how do they find you?
through word of mouth, through existing clients that move on to other organisations, through Mental Health
Hmm.
First Aid England, and you can book training through Mental Health First Aid England. They've got a bank of instructors. There's a lot of us. I also train instructors to deliver the courses. So I'm going to be
Okay.
one in a few weeks.
Ah,
That's
okay.
6 days over a couple of weeks, which is
Wow.
really intense stuff.
Wow.
So that's another thing, because I train people to deliver courses that I deliver, which is a
Yeah,
fantastic
yeah.
thing because it multiplies the amount of
I
reach.
it, Yeah,
the
you'll get to
difference
your
I can make. Yeah, yeah, just sort of exponentially. Uh, it just, yeah, it's limitless, really. I guess if because more people are engaged in training, more people that then go and potentially have those conversations. So I enjoy doing that, and I'm also involved in developing products with Mental Health First Aid England as well. So I'm involved in sort of writing the courses too. So that's it, and I'm part of the advisory group for the organisation. I've been involved in them for a long time, and I've got a lot
yeah.
of investment in there as well. It really is. It's more than a suite of courses, though. It's a mission. It's a it's a quest to actually increase the mental health literacy of the population, and to get that tipping point that we can actually start to have conversations and open up things like mental ill health, pressures, emotional pain, ultimately suicide, and have caring conversations that change some of those statistics and reduce those numbers of people who are in very dark places. So it's I can't imagine a better job, to be honest. And it's not a
Yeah,
job. It's
yeah,
yeah.
not even a job for you anymore,
No,
right?
no,
Not
no, no.
not really.
Yeah,
Yeah, it's not a job
no.
anymore for you. I I remember one time in say young, kind of just first job, maybe first or second job in California, and I had read that you could get disability if your job caused you a certain amount of stress.
Yeah,
And I was like, wow, it's amazing. And then I found out it was like 15%, or I think it was 15% of your emotional distraught come from work.
yeah.
And I just thought, my comment back then, being the caring human that I was like, if 80% of your job isn't caused from work, you should be fired. You should be you what are you doing in that? So to me at that point was, if the job's not 80% of your life stress,
Yeah.
then you're not working hard enough. You're not in a hard job. You should be fine to bet, you should be terminated because your job's too easy.
That's interesting. Yeah, that's an interesting Pareto principle, I think. Yeah, the 80/20 rule. Um,
Yeah, boy, I was in the other camp back then. Um,
yeah, 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 yeah. It's the flip side, really, isn't it? But yeah, we get our heads down. We're driven. We've got purpose. We've got a career. We've got a
yeah,
role. We just get lost in that, don't we? We don't see the light, so we can get really stuck in there as well.
and these are the kind of people. I was the kind of person that you're going to have to overcome at the workplace with this kind of
Mm.
attitude. I mean, it can't be that different. I mean, it is, but not. There's still going to be people like me thinking that at that age, that
Yeah,
the work is a place where it's, of course it's stressful, and if you're going to take the easy way out by, the easy, I would have been very dismissive of somebody with mental health issues back then in the day.
yeah, yeah.
Um, Shamefully so.
But I think it's opening up the conversations. It's the theme for Mental Health Prevention Day this year, which was yesterday. It's World Mental Health Prevention Day. It was changing the dialogue, starting the conversations. The more we can
Mm,
change the dialogue and have conversations, open conversations about being human, yeah, feeling,
yeah.
having struggles, yeah, and the strength that actually gives us to actually open up about our own vulnerabilities in a safe way is the way forward. And when I say that, I think about men. I think about opening
I
about
know,
vulnerabilities
still.
with men.
I know.
And people say it, it's almost like a finger wagging thing, in the workplace, out the workplace. Men, you need to talk more about your feelings. You do, and that's the wrong place to start. Really, no one will talk about their feelings, irrespective of gender or gender identity, if there's no one there to hear them. So it's back to that. So we need to actually appreciate that. We need to actually have the dialogue. We need to have the conversations. We need to
Mm,
construct organizations with openness and clarity and with top level support and getting the basics right around the right sort of health and well-being policies, but also crucially line manager training to enable those conversations really to happen. So all of that is about to happen. It's nonsense, by the way, to say men find it difficult to express their emotions. I follow Sunderland football team, soccer team for
yeah,
you.
yeah. Sunderland. Yeah, I know a
And
little bit about football. Not
you might
much,
have seen
but a
them
little.
on Netflix a little bit, but
Yeah, yeah. I did
yeah,
see the lasso.
yeah, oh wow, Ted Lasso, that's another thing. But I
A
was
great
at
book.
one of the games recently. We beat Sheffield Wednesday 4-0. There were lots of men with me there. We didn't have any difficulty showing our feelings because the conditions existed to normalize that, to make it okay. So we need to create conditions that make it okay to talk about our feelings, if you like, or just anything that
Yeah.
makes us human. So yeah, I guess we need to recreate the football stadium in workplaces.
Yeah, where it's okay to, I shared with you before we started that I had a conversation with a friend, and he's in the UK now and going through a tough divorce,
Mm,
kids involved, and and it's not pretty. And he was,
yeah,
and I think I felt pretty good that he shared with me that it was, he was in a dark place at times. There was some, he was in a rough spot, and so it's a good reminder for me to send him a note to say, hey, call me anytime you need
yeah,
to
yeah,
talk, because
yeah,
there'll be some tough. He's in the middle of it, and
yeah.
I don't. It doesn't look like the storm is passing anytime soon.
Right.
Um, and but I did. It is nice that someone would share that with me. It feels like a
Yeah,
privilege.
yeah.
It does feel
And
like it doesn't feel like a weight or anything else. I feel quite
yeah,
happy she was able to feel comfortable enough
yeah.
to share it.
It can be a simple text message, can't it? Or a, WhatsApp
Yeah,
message. It's just thinking of me. You okay? It's just very simple. Just I'm here if you need me.
that's
So
oxygen.
yeah, it is emotional oxygen, Ken. Yeah,
That
absolutely. It's
I love that phrase. Like
it's
they're literally suffocating.
it's not me. It's Stephen R. Covey, the author. The seven habits of. Sorry, hang on. The
Yeah,
7 habits of highly effective people. Yeah.
yeah.
But I
Um,
really believe that it's really important to me, that emotional
it,
oxygen thing.
I it's super. I'm a big fan. And I'm gonna borrow that phrase as well. I'll forget it was Steven. I'm just gonna say it was you, Clive.
Go on,
Yes,
I'll take the credit
yeah, and
falsely.
especially when it's related to mental health, it's definitely makes more sense that it's for you, especially in that
Okay,
context.
I'll take that
So
one.
I guess do you have if for people to find you, do you have a website or just on LinkedIn? How do they?
I'm on LinkedIn. I don't have a website. No,
Yeah,
I just didn't bother really, to be honest.
yeah. Well, sounds like you got
LinkedIn is
enough
the
people
best way.
chasing you.
Yeah,
Yeah,
yeah. I mean, word of mouth is really powerful, and I do get business pushed over me from elsewhere. I do work directly with MHF England, so get work that way as well. But LinkedIn or have a look at Mental Health First Aid England's website, mhfengland.org, to find out
and
about the
also,
courses
yeah.
and suicide first aid courses as well. It's the National Centre for Suicide
What's
Prevention and
the
Education,
website again?
mhfaengland.org, and they provide mental health first aid courses and suicide first aid courses
Okay,
actually. So
okay.
you can have a look at that, or drop me a line and we can talk
Sure,
about the
yeah,
course.
yeah. Always better find Clive on LinkedIn and drop him a note. Any kind of parting words or parting, maybe I don't, kind of
No, well, I think
a
it's
message.
a message. I mean, I went into mental health nurse training because I saw the advert, "Come on, making difference, become a mental health nurse." But I also had my very dark
Hmm.
times, and that was the real spur to actually help people to actually see a way out of the pain. And at the time, way back in my early 20s, I couldn't see any way out of my emotional pain. So it's the ability to actually have faith that things can change,
Hmm.
that there is some light at the end of the tunnel there, that there is possibly a different way that your situation may pan out, and it's just pressing that pause button and reaching out for support, getting that other view about what's happening with you right now, and getting the confidence and the spark to actually move forward. So it's about
Hmm.
opening up. It's about seeking support because support is out there. In the UK, we've got a great website called Hub of Hope, HUB of HOPE, which has got lots of organisations, voluntary, statutory,
Hmm.
peer support that you can sort of reach out to. So I'd just say Hub of Hope, anyone in the UK, or just I was working with an organisation. We're looking across. It was delegates from across the globe, and there's Samaritans of Singapore, for example, in Singapore, there is always an organisation somewhere that you can reach out to. Reach out. They will
Yeah.
make a difference to you.
Yeah, there is. I think that is one great thing. In the US, they've got the suicide hotline now at 811.
Yeah. Yes.
Fantastic. You know, so close to 911, and it's clearly an
Yeah.
emergency.
Yeah. Call them. If
Clive,
you're on,
call them.
Yeah,
Call them.
call
I
them.
think reach out to somebody, call people. You know, there's people willing to. It's a different world now, and I think if you call, people will come. People will come.
Yes. Yeah, they respond. They hear the call.
Clive, thanks so much. Really appreciate what you do. It's a great,
Absolute pleasure, Ken.
man, a great service you've done for humanity. You know, you've saved some lives. You just haven't met them.
We can all do that. We can all save some lives. Yeah.
Yeah,
Let's
we
do
can
it.
save lives, and we don't have, and we may never know.
No, and that's okay, isn't it? Have those conversations. That's what we need to
Yeah,
do.
that's okay. I don't need to know. I got enough going on. But if we're helping it, if we help one person, that's a miracle.
Fantastic.
That's
It is.
Just give one more person another week to figure things out. Thanks
Absolutely.
again, Clive. And
Thanks for the opportunity, Ken.
Yeah, and thanks everybody for listening, supporting mental health today, and all that we're doing at the show here. Great guests like Clive, getting a chance to tell their story and for us to hear it and to know what's going on in England and other parts of the world and the models, so we can learn what's happening in other places. If you're listening on audio, drop down to the bottom somewhere in the bottom. It is are the ratings, and then a chance for you to leave a note for us and a message, kind of guess you like and the kind of shows you like. Clive, hang on for 30 seconds. I'll see you on the other side.
Cheers.
Yeah, loose, baby.
We're about to go and make this vessel with these great professionals at Public Glass. We're not part of the community, but we're from the outer family of glassblowing. Yeah, we're gonna go make a magical giant jar with optic lenses so that if you turn it, it changes all the time. So if you change the way you look at things, the things you look at change.